Pleasant day, everyone. So this will be the third lecture in the series on environmental health. So I'm going to talk about solid waste management. Solid waste management is the most visible problem of the environment today. So we have 0.70 kilogram per capita generation per day of solid waste in high urban centers, 0.50 kilogram per capita in first-class cities and municipalities. And in rural areas, we have 0.30 kilogram per capita. Solid waste generation per day is about 30,000 tons, and this will increase by 40% in the next decade. 73% of the solid waste generated comes from domestic households. And in terms of waste composition, so 45% comes from kitchen waste. If you would look at the total waste composition of solid waste, only 7% are residuals. So 69% are biodegradable and should not be placed in the sanitary landfills, and 24% are non-biodegradable or can be recycled. What are the issues of solid waste management in the Philippines? So the public generate waste indiscriminately and throw them out in the streets or any vacant alleys, lots, or conveniently in any waterways. So mixing their waste without thinking of the adverse impacts on the environment and public health threat. So I hope that none of you students are like this. We also have high cost of collection service that is heavily subsidized by the LGUs. In terms of the LGUs, the solid waste management program in the LGUs in the Philippines are one of the most corrupt government agencies. So we have lack of enforcement for planning and administration when it comes to solid waste. So right now in Metro Manila, we still deliver our solid waste in Rodriguez Rizal. Recycling facilities are concentrated mostly in high urban areas. We have lack of proper treatment facilities on healthcare waste. Hospitals will only have contracts on how they will dispose of their healthcare waste. But we do not know where these contractors are actually delivering the healthcare waste of the hospitals. Funeral parlors, health clinics, health centers, medical and dental clinics are not being monitored for healthcare waste generated and treatment being employed in the disposal system. And most of the time, these funeral parlors, health centers, small clinics dispose their healthcare waste together with the solid waste of the community. So that will increase the risk of infection from among these health centers and health clinics. We have some difficulty in finding a suitable sanitary landfill site in the Philippines, and brought about also by high cost of development, operation, and management. And because of the high metric tons of waste being generated, most of the sanitary landfill being operated ended up as open dump sites, just like the Rodriguez Rizal sanitary landfill, which is now an open dump site. This is the best solid waste management formula. Okay, so we need first to segregate, then reduce, then recycle, then reuse, then repair. Then the biodegradables should be placed as compost. And the remaining 7% material should be the only one disposed, okay, and taken by the solid waste management trucks or the dump trucks. If we can do all of these, if we can do waste segregation, then we will have no problems with sanitary landfills, and we will have no problems with our dump trucks. So we have to learn how to segregate the biodegradable from biodegradable and the special waste. And again, only the non-recyclable should be placed in the sanitary landfills. Okay. Color coding, how tricky is the color coding? We have different color codings. Different hospitals have different color coding systems. The international color coding system for hospital and biomedical waste is different from the hospital color coding system in the Philippines, and some hospitals also have their own color coding system. So it's really hard to follow this color coding system because the standards are different for every hospital. For the closure and rehabilitation of dump sites, the deadline by law is that should be closure of all open dump sites should be done February 16, 2004. And February 16, 2006 should be the closure of controlled dumps. But in May 2021, DNR closed 335 open dump sites. This is 17 years after the deadline. So as you can see, we are not really following context of the law. We are still operating a lot of open dump sites in the Philippines despite the law. So what does the government do? So we have waste diversion programs. We have the community-based establishment of materials recovery facility. We also plan to establish a materials recovery facility in UERM before, and we also plan to establish before a globe in UERM where we can put all of the plastics, especially the plastic bottles. So we also have the nationwide search for model barangays in the Philippines. And we have recyclables collection event and waste market. We also have the recycling industry development. Okay. These are examples of the materials recovery facility. And these are some of the products being recycled in materials recovery facility. We also have programs on recycling of biodegradable waste, so producing biogas technology and conversion of organic waste into energy and biofertilizer by anaerobic process. So these are samples of recycling of biodegradable waste. So we have this hybrid biogas run generator, cooking stove, LPG modified double burner biogas stove, and lighting. We also have the biodiesel technology or used cooking oil technology converted into biodiesel for our cars. And these are some of the materials also being recycled. So recyclable materials can be converted into bricks, catwalk tiles, blocks, and synthetic planks. We also have these eco parks being promoted by the government all over the Philippines. So this is not only in support of the solid waste management, but also in support of the climate change. So we have RA 9003, the Ecological Solid Waste Management Act. This is about waste segregation. Okay, so we should segregate our waste because that's already a law in the Philippines. And these are the fines and penalties if you do not practice waste segregation. But alas, in the Philippines, all of these are just laws. We do not really practice this, especially in Metro Manila. Okay. So there's still no waste segregation in Metro Manila. In our city before, in Las Piñas, then city mayor, after the implementation of the law, after the law was ratified, the mayor of the city of Las Piñas usually gives away color-coded garbage bags for every household so that we can segregate the waste. But that only lasted for about 3 months, 6 months. And after that, no more implementation of the Waste Segregation Act. So these are the government plans. So establishment of materials recovery facility and sanitary landfills, iwas basura, iwas crisis programs, and establishments of eco parks. So in summary, I have discussed the current Philippine situation on solid waste, the issues on solid waste management, and the waste diversion program of the Philippines. So thank you very much, and try to see the next lecture on climate change. And please subscribe to our YouTube channel and like our videos.